Sounds
Welcome
good.
to our podcast with Life Gives You Lemons. I'm Kevin Henry, and my partner in crime in life is Palmi Henry. I have a rare disease known as spinal cellular ataxia, which is a neuromuscular disease. This has left me mobility challenges as well as with a speech impediment and noise-induced anxiety.
Living with these disabilities for over 20 years, we have developed helpful hints and life lessons that we would like to share with you that has made our life easier and possible in some cases. We consider ourselves disability advocates and intend to educate ourselves and you about other disabilities and issues, and also talk about things we find interesting and frequently encounter when we're out and about. Hey, Kevin.
Hey, Palmy.
Hey, thanks for showing up today.
Thanks.
So, guys, we're a couple days behind getting this podcast out. We've both been having a little bit of health issues. Kevin is in the midst of passing a kidney stone right now. So he's not the cheeriest person I've ever met right now.
Yeah, but I can deal with it for the short time.
You're living on Motrin for a while.
Yeah.
Motrin and lots of cranberry juice.
Yeah.
And pills. So so what we're going to talk about today is stiff person syndrome, SPS. I had never heard of this. Had you?
Not until it affected Celine Dion.
Right. That's why we're talking about this today. That was our little dog there. He just had a little cough. I was watching an interview with her on the morning show today. I love Hoda. Hoda's one of my favorites. So I watched that a lot. And she was explaining that she came down with the stiff person syndrome about 3 years ago, I guess. They were announcing her documentary. It's called I Am Celine Dion. And it premiered on Prime Video on the June 25th, so it is available today. I'm sure everybody's familiar with Celine Dion, the French singer.
French Canadian,
yeah. She has had somewhat of a tragic life, has dealt with a lot of illness too. Her husband died of throat cancer after she had shortly after she had given birth to a set of twins. So she has three boys, I believe it is. So let's talk about the stiff person syndrome. Let me explain to you what it is and the symptoms, the causes, and the diagnosis. So according to the internet, SPS is a rare and complex neurological disorder. Now, see, I didn't know it was neurological. Did you?
No, I did not.
It's characterized by stiffness of muscles and painful spasms, which is very similar to what you experience, Kevin.
Yeah. You have to tell some more Celine Dion stuff to
get more of your symptoms.
Yeah.
Okay.
But a lot of neurological stuff encompasses spasms and stiffness and such.
And difficulties with movement.
Yeah.
These symptoms primarily affect the trunk muscles, but can also involve the limbs and other body parts. The spasms can be triggered by sudden movements. That's
where you get involved with where it kind of like ataxia, and that like you lose control over your limbs and your trunk. But like you can walk per se, but you better be hanging on to stuff because at some point your legs are going to keep walking which may or may not be a good thing. But your trachea can decide, we're out of this. So there's all kinds of weird positions you can get yourself into.
And same thing with ataxia. The spasms are triggered by sudden movements, noise, and emotional distress. So that all seems familiar to us.
All seems to combine, yeah.
Yeah. The symptoms, it also often begins with stiffness in the legs and the back, and which can lead to a difficulty walking and changes in position and posture. I'm sorry. Over time, the muscles stiffen and can progress and become more widespread, causing significant disability. The cause, which I find is fascinating, is autoimmune. It's considered an autoimmune disorder, where the body's immune system mistakenly attacks its own tissues. And in many cases, people with SPS have antibodies against a enzyme called GAD, which is involved in the production of the neurotransmitters that help control muscle movements. Kind of makes sense there, yeah.
Sure.
The diagnosis is based on same thing as a lot of autoimmune diseases. It's the presence of characteristic symptoms, the detection of the GAD antibodies, and the exclusion of all other conditions that may have caused similar symptoms. The EMG test can also support the diagnosis. And treatment, there is no cure. Treatment is available to help with managed symptoms. Again, same as ataxia. These may include medications and to reduce the muscle stiffness and spasms, as well as auto therapies such as intravenous immunoglobulins and other therapies. Of course, if you're experiencing this, please contact your nearest health care professional for a proper evaluation. Because as we always say in these podcasts, we are not doctors. Let's say it together. We are not doctors. So in the documentary, I am Dion. Go ahead.
Celine
Dion. She goes through how once she's been diagnosed, she ended up stopping a 3-year, $100 million contract of residency at Las Vegas, at the Las Vegas, one of the hotels.
Las Vegas.
Yeah, she ended up canceling that. And we definitely, have to, and she says in the interview that it's the pain, it's like being strangled while she tries to sing. So it has affected her voice, and so she's learning to come back from that. So that's got the same struggle anybody with disability goes through. So I imagine there was some depression there and figuring out lots of questions because she's a single parent of 3 children.
Well, I'm sure that there was more anxiety involved for herself about her voice because that's such a key part of who she is.
That's her moneymaker.
Yeah, I mean,
yeah, and
my
she's a single
voice
parent.
is jacked up, but
no one's asking you to sing.
yeah, exactly.
In fact, we're paying you not to sing.
I don't even go to karaoke, much less, try to make records or anything.
There you go. So, yeah. So that was, and it happened to, she's bringing awareness to the disease because of her celebrity status. So that good for her. We need to show what's going on out there to cause all these disabilities. So anything else you have to add on that, Kev? It's kind of going to be short.
No.
It's kind of we're going to have a shorter podcast this time because Kevin's really not feeling up to it, and I'm not feeling up to it either. I was in the hospital for 4 days prior to this, so.
But we are going to talk a little bit about our recent health experiences.
Yeah.
There is a nationwide shortage that was painfully obvious during Palmi's hospital stay.
Yeah. It's a shortage of nursing. And
we are only going to touch on it to bring awareness to the point. I don't think there's a solution that we can bring about, because I'm pretty sure everybody in the medical profession know there's a nursing shortage, and they're obviously taking a few different steps that try to address that. And I don't think there's any one good way, perhaps some better than others. In our area, they seem to do a lot less nursing and more like hiring the lower level of nursing help who have to be supervised.
yeah, and overwhelmed too because of the patients and stuff. So yes, there is a current significant shortage of nurses in the United States, and let me tell you some reasons why shortage is expected to increase due to several factors. The aging population. As the baby boomers generation ages, the demand for healthcare services increase. That is the largest age group right now, and that's requiring additional nursing. Retirements of nursing. Many nurses have reached retirement age, leading to a decrease in the workforce. Burnout. So we've all heard about that, with the COVID pandemic. It exacerbated burnout among healthcare workers, causing many to leave the profession. That had to be heartbreaking, every day, nothing you could do for them, that had to be just awful.
Yeah.
A lot of mental illness due to that.
Especially once COVID had basically got to the point, like my neurologist, Dr. Lee, has privileges at both our area hospitals. And so they would write as consults their COVID patients who had symptoms delving into the neurological. And there wasn't a whole lot known about what lies beyond COVID. So it was basically the doctors winging it when they got to that stage.
I think it was them winging it on everything, because we were trying to find cures and just to help with symptoms even,
Yeah, but just imagine what has to happen at that. It's just a bunch of nurses to say, the COVID doctor with the patient says, get hold of a neurological consult for this guy. And some nurse has to talk to another nurse who has to find an opening for her doctor. It's like...
It's leaving it all up to the nurses, yeah.
Yeah.
Also, educational bottlenecks. Nursing schools are struggling to expand their capability to meet the rising need for the new nurses. Projections indicate that by 2036, there will be a shortage of approximately
337,000.
Yeah. Well, close to 38,000.
Yeah, 970.
Efforts are being made to address this issue, including increasing funding for nursing education and improving working conditions to retain current nurses. It's a time to be a nurse right now, apparently. I know there's a lot of bonuses out there for hiring. So let me give you kind of the reason we thought of this was because of my recent
hospital
stay. Yeah. So I went to the emergency with abdominal pain, And I waited 6 hours at the emergency room. I came in by ambulance because Kevin could not drive me, and I was feeling like I was going to pass out. So I didn't trust myself to drive myself in. And my brother-in-law and sister were all working. So that we had to opt for the ambulance way of going in there. But that did not stop or help with my wait time at all. So as soon as I got there, they triaged me and then moved me to a waiting room where I sat for 6 hours. I got there about 4:30, and eventually I got seen probably by 9 or 10 that night. At that point, I had left when I thought it was unbearable. The pain was unbearable. Believe me, it got much worse several hours later. So then once they got me up to the room, the first person I saw, of course, was the nurse. And she said I was in the surgical wing because at that point they thought I would have to have some type of surgery with a gastric bypass or gastric sleeve. You can't have a blind NG tube installed, which would be what the current solution for my problem was, and which means I would have to be put under in order for them to put the NG tube in. So,
and whenever they talk about anesthesia, they consider that to be surgery.
Right. Yeah. Or they, there's other ways to fix my condition also, but they would all involve surgery. So anyways, I got up there, and the first thing the nurse, very nice nurse, said, Carrie, I believe her name was, said to me, she said, I'm the only nurse on the floor. She was an RN, and she said, I have 6 patients currently now. There may be more later, but I do not have a technician tonight, which the technicians typically take your vitals throughout every couple of hours to make sure what your status is and track your symptoms and stuff. I did get to the room about 10, but I never saw a doctor until 2 a.m. The hospitalist showed up about 2 a.m. However, she did not add much but nothing could be done until I saw her. No orders could be put in for the nurse to do anything for me until I saw the hospitalist. And I'm sure there was other more serious conditions, that they were dealing with. But I'm just telling you, that's, one nurse, one RN, one hospitalist for the whole hospital. And, the waits were just outrageous. So I never even got I did get some pain medication in the ER very shortly after I was seen by a doctor down there. And then once I had my CAT scan, then that's what sent me up. That was the conclusion they were looking for. I thought I was having another blood clot issues, but it did not turn out to be that. But it was serious. But so, that poor nurse, I saw the doctor at 2. But she never had any saline or anything attached to me, antibiotics or anything, until almost 5 the next morning. So, no fault in there, but, that was pretty not very efficient.
Pretty shoddy.
Yeah. And I'm sure she was doing everything. I mean, there wasn't no point where she wasn't running her butt around, So lack of personnel, I don't know. Fact that they think the hospital thinks one nurse can handle 6 patients. I don't know. I don't know the thought behind that, but I don't think it was very efficient. And so we got talking about why this was, and this is why we're coming upon this subject, shortage of nurses. I didn't know a lot about how to obtain a nursing degree. Do you?
Only a little.
Yeah.
I know there are some schools for nursing, but I knew very little about it.
Yeah, I didn't ever want to be a nurse, so that was not something I had looked at in details. A lot of my friends are nurses, so I know it is a noble cause. So there is several degrees. Bachelor of Science in Nursing is the BSN. The duration is 4 years of schooling. The role is the same as an RN, but with more opportunities, advancements, and higher salaries. Completion of the BSN program and passing the NCLEX/NRRN exam is what is required. There's a Master of Science Nursing MSN. The duration is 2 to 3 years post the BSN, so we're talking 6 to 8 years after that. The role involves advanced practice roles such as nurse practitioners, clinical nurse specialists, nurse educators, or nurse administrators. It requires a BSN RN license and completion of the MSN program. There's the Doctor of Nursing program, which is DNP. The duration is 3 to 4 years post the previous one we just talked about, which is the Master of Science in Nursing. The role is the highest level of clinical nursing practice, leadership roles, and advanced practice. It requires an MSN RN license and completion of the DNP program. Local nursing programs, there's quite a few here in our area. I, in fact, attend a Red Hat group where I think of the 16 members, I think 10 of them are nursing, have the degree of nursing. I know there is an below that there is an SN, or SNA. Is that what it is?
Nursing assistant, yeah.
Yeah. And those are what I just previously referenced as technicians. I think they call them technicians in the hospital setting. And then, of course, there is an LP, which I believe is lower than the RN and has less schooling. In our education research, we did not pull up those details. But if you're interested, this seems like the way to go for the future. If you're in there's a lot of stuff that's involved in this. I know I cared for my dad for 1 year, and it was it's a 24-hour situation in home, but it is very heart-wrenching, stressful. You really have to be a person that has a lot of empathy in order to do something like that.
And on the kidney stone front, it just hurts. If you go to the doctor, it hurts. If you don't go to the doctor, it just still hurts. So.
Well, Kevin has a history of kidney stones for many, many years now. So he's really familiar with the whole process. The first time we went, we did take him to the doctor, and, we figured out what it was. He's now very familiar with the pain. And so he doesn't like to be in a hospital setting. He's been in there too much. So
well, yeah. It's
sit and wait, basically. Yeah.
Sit and wait.
That's kind of what I ended up having to do. So I ended up 4 days in there, but if I could have done it without being there, I would have, which is what he's choosing to do right now. We do cranberry pills and cranberry juice and lots of liquids. You just got to get it out, babe.
Yeah, lucky me.
All right. So that would be our episode this week.
But we are going to talk about some life insurance issues and some medical insurance issues.
Right. That's going to be our next topic. And we're lucky enough to have a professional that's going to do an interview with us. We'll have more details on that episode. But for now, I guess let's say goodbye.
And no, I want to say goodbye after I give a shout out to our new European listeners.
Oh, really?
Well, I'm not going to name them, but they're from Great Britain, Germany, France, the Netherlands, and Italy.
Wow. We're international, babe.
Yeah.
Please comment, make comments, and let us know what you guys want to hear about.
Especially, I understand that you'll be confused when we talk about the way we do insurance and stuff as far as it's concerned in the U.S. because it's totally different in some of those countries.
Totally screwed up.
Well, we're not necessarily saying your system is screwed up.
No. Our system is screwed up.
Yeah, our system is like
I think there's
beyond
struggles.
belief at times.
Yeah,
So,
I think there's struggles no matter where you're at.
so we tend to point out things we know are glaring, and they may not be issues for your
But
system.
share with us. Say, hey, all of our international listeners, share with us and tell us what your healthcare is like.
Because one of the things that I really don't recall the specifics of this, but it was a family who had a child, and they took the child to Italy to get medical care, where it didn't cost them anything, which is true, but it did cost the Italian taxpayers something, so I don't know how.
I think that's called medical. There's an actual term for it. I used to be a travel agent, and we used to have people that would come in and do that. It's medical. I can't remember what the name is now. Hey, if you know, put it in the comments.
Yeah, by all means, if you are living in Europe, our website has a feature where you can leave us a message.
Voice message.
However, I'm not sure it costs is free for Europeans as it is for Americans. But there is also an email contact. You can send us email for free.
Right.
And, I understand that everybody with a disability is watching every little penny they can. So I understand if you need that free option, that's,
we're here for you.
we understand that. And if you don't want to have your name or your email disclosed, see that as well.
Okay.
We don't have email marketing or telephone marketing or advertising or sponsors. So, be reassured by those things and talk to some of your friends. And when it comes out that you're not going to get spam from us on your email, tell your friends that as well.
Yeah. The only thing we do is we ask for you to support us. And if you do, we have that prize at the end of the year, our artwork from Deanna. I said it wrong last episode. It's Deanna Ives is producing an artwork for us to give out at the end of the year.
And as far as I know, there is no problem with shipping that prize to Europe. So if a European wins, hey, you win. We do need your email for that so we can get back in touch with you.
All right. We done tonight?
Yes, we are.
Back to your sick bed, Kev.
Thanks. We'll talk to you guys next time.
We are always looking to improve the podcast, so if you want to hear a specific topic, have a differing opinion, want to add something to the conversation, drop us an email. Our contact information is listed on our website. It's www.whenlifegivesyoulemons.net. We have recently added a companion YouTube channel called Making the Lemonade. If you enjoy the podcast, continue your enjoyment by joining us on YouTube.